My name is Gary Vickers, born and raised in Chicago, here in St. Louis for multiple years. I've been practicing medicine for over 20 years. I went to Kirksville College of Osteopathic Medicine, and residency was here in St. Louis at Deaconess Hospital. Prior to that, I actually worked at Deaconess in the medical lab as a medical technologist, since that was my first degree out of college. In high school and college, I worked through construction companies, and I still do that today, doing large home projects and giving input on building decks and doing home remodeling projects. The house that we purchased back about 15 years ago, I've done all of the outdoor landscape. I've done all of the rooms have been remodeled and upgraded with finished trim. The basement was also something that was unfinished by design when we bought the house, and I actually designed and built that. Of course, my wife had input. So when I have a Saturday off, because I believe in you have to take time for yourself so you can be there for your patients. I'm going to be following my kid with baseball, hoping my daughters will also go to the ball games, but they're both in college. I'm working on projects around the house. I'm playing golf. I may be out hiking in the area, just doing something to stay outside and be physically active. My sit around and do nothing time is still not a big major part. I'm always doing something. As the word implies, family means you get to take care of multiple facets. So you're taking care of the young, the middle-aged, the elderly. You get to know the family. You get to know especially with these times the way they are now, their exposures and experiences of how the world is affecting them and how they're trying to affect the world. So the benefits of family medicine is you take care of the whole group. So originally I did family practice residency because of the depth of patient exposure. And over the years, I've taken that practice opportunity and honed it to taking care of an older population starting at about 18 and up, including health maintenance, diabetes, stroke care. I've shown some interest in the different degrees of diabetic treatment, including insulin utilization if needed. Originally, as a kid, I was very inquisitive about how things work. And I showed interest as going into looking at engineering, realizing that wasn't something I was going to want to actively pursue. Medicine had always been that one attractance, and I think it was childhood exposure to family members getting sick that gave me that interest and the drive to go for a pursuit of medicine practice. And family medicine, because it takes care of the entire family, really is my strong drive for moving forward. Through past exposures and experiences, my patient population has always appreciated the fact that I let them speak their mind. I let them present what their concerns are. We explore their internet searches and their input that they've gotten from others to try to come up with a unified plan that the patient feels they can potentially experience and pursue going forward. I treat patients the way I would want to be treated when I'm to a point where I need medical care also. So treating with respect and listening and allowing the patient to speak about what their condition or concern is so that we can work on a plan together that comes up with education for the patient and then the appropriate treatment plans that can be put in place. It's an institution where the staff and the personnel care about what they're doing. We're attempting to try to get patient satisfaction based on showing people how much we care and how much we can point in that direction of positive reinforcement and making a collaborative arrangement between physician, staff, and patients.